Hello, gentlemen. I'm Dr. Rose, a urologist and men's health specialist, and for the past 7 years, I've worked with men over 50 who want to regain confidence, intimacy, pleasure, and a stronger sense of connection in their relationships. Today, we're going to discuss a subject that many men feel uncomfortable bringing up, even with a partner, and that is how to use your fingers to pleasure a woman in a thoughtful and effective way. You may be wondering why this matters, especially if you're older and have always assumed that intimacy is something you simply learn through experience. But that assumption is not always correct. In fact, for men over 50, understanding how to approach this kind of intimate touch with patience, awareness, and good communication can make a meaningful difference in how connected and satisfied both partners feel. Before we get into the practical side, take a moment to like this video, leave a comment telling me where you're watching from, and subscribe to the channel so you don't miss future health and intimacy guidance created specifically for men over 50 who want to feel more confident and informed in their relationships. Let me begin with one of the most common misconceptions I hear. Some men believe that this kind of stimulation is so simple that there is nothing to learn. That idea is simply wrong. Just like cooking, playing golf, or learning any other physical skill, understanding the basics and paying attention to what you are doing can make a significant difference. The goal is not to perform a routine or follow a rigid formula. It is to understand how a woman's body responds and then remain attentive to her individual reactions. From a biological perspective, fingers can provide a level of flexibility, sensitivity, and control that can be useful for certain forms of intimate stimulation. Areas such as the clitoris and surrounding tissues can respond to changes in pressure, rhythm, and movement, while internal stimulation may feel different depending on the individual woman. This is precisely why there is no single technique that works identically for everyone. What matters most is being gentle, observant, and willing to adjust. There is also an emotional side that should never be overlooked. Women do not respond only to physical touch. Feeling respected, listened to, and cared for can strongly influence how comfortable and receptive they feel during intimacy. In that sense, intimate touch can become more than a physical action. It can communicate patience, attention, and genuine interest in a partner's experience. And then there is the practical side, which is often ignored because it seems too basic. Clean hands, short and smooth nails, and gentle movements are essential. Neglecting these simple details can create discomfort and, in some cases, cause small injuries or irritation to sensitive tissue. I have spoken with many men over 50 who believed that their best years of intimacy were already behind them. Yet after learning to slow down, communicate more openly, and pay closer attention to their partners, many discovered that intimacy could become more satisfying and emotionally meaningful than they expected. So today, I want to walk you through 7 common mistakes and the principles that can help you avoid them. These are straightforward ideas, but they can make a major difference when they are applied with patience and awareness. The first mistake is skipping foreplay. Many men think of foreplay as nothing more than a short introduction before the main event, something that should be rushed through. But biologically, a woman's body often needs time to become fully aroused. Blood flow to the genital area increases, natural lubrication develops, and sensitivity can change as arousal builds. Moving too quickly may reduce comfort and make stimulation less enjoyable. Taking time before more direct stimulation communicates that her experience matters and that you are not simply trying to reach the next stage as quickly as possible. Begin with affection, kissing, gentle touching, caressing, and gradual teasing before moving toward more intimate contact. That sense of anticipation can help the body and mind become more prepared for pleasure. One man in his early 60s once explained that he had spent years moving through intimacy too quickly because he assumed his partner preferred it that way. After learning to slow down and spend more time building anticipation, he noticed that her responses changed considerably. She became more relaxed, more receptive, and more engaged, and he realized that what he had considered unnecessary time had actually been an important part of the experience. That lesson is worth remembering because intimacy is rarely improved simply by moving faster. Often, the opposite is true. Slowing down gives you more opportunities to notice subtle changes in breathing, movement, muscle tension, and other signals that can tell you whether your partner is comfortable and enjoying what is happening. And that brings us naturally to the second mistake, which is rushing into more direct stimulation before her body is ready. The second mistake is rushing into direct internal stimulation. Some men become so focused on getting to the next stage that they forget the body needs time to respond. From a biological perspective, sensitive genital tissues can become more comfortable and receptive as arousal develops gradually. Moving too quickly can create discomfort and may reduce the pleasurable sensations you are trying to create. From an emotional perspective, rushing can also send the wrong message. Your partner may feel that you are focused on completing an action rather than understanding how she feels. Intimacy works much better when both people feel that their experience matters. Instead of immediately moving toward internal stimulation, begin with gentle external touch and allow her responses to guide the pace. Pay attention to changes in breathing, muscle tension, movement, lubrication, and other signs that she is becoming more comfortable and aroused. These signals can tell you much more than simply following a predetermined technique. I once heard from a couple who had experienced exactly this problem. The woman explained that her partner had previously moved too quickly, and she often felt that there was no time for her to become fully comfortable. After he learned to slow down and focus on her responses first, her experience changed considerably. She described feeling more noticed and more involved rather than simply being the recipient of a routine. That is an important distinction. Good intimacy is not about performing a sequence of movements perfectly. It is about responding to another person in real time. When you slow down, you create space for communication, comfort, and trust, and those factors can make physical stimulation much more enjoyable. The third mistake is assuming that more pressure or more fingers automatically means more pleasure. This is another common misunderstanding. Stronger stimulation is not necessarily better stimulation, and adding more intensity before a partner is ready can have the opposite effect. The tissues involved are sensitive, and excessive pressure may create discomfort rather than pleasure. Emotionally, forceful or overly aggressive movements can also make a woman feel that her reactions are being ignored. That can cause her to become tense or withdraw instead of becoming more relaxed and engaged. A better approach is to begin gently and allow the level of stimulation to develop naturally. Start with one finger if internal stimulation is comfortable for her, and keep the movement controlled and responsive. If she clearly communicates that she wants more intensity or a different type of stimulation, you can adjust accordingly. The key is that increased intensity should come from her comfort and feedback, not from an assumption that stronger automatically means better. One man told me that he had initially believed using 2 fingers immediately would make the experience more satisfying for his partner. Instead, she found it uncomfortable and became less responsive. Once he changed his approach and began more gradually, she was much more comfortable and engaged. The lesson was not that one specific technique was universally superior. The lesson was that individual preferences matter. Every woman has a different level of sensitivity, and what feels comfortable for one person may feel completely different to another. That is why communication and observation are more valuable than memorizing a particular routine. The fourth mistake is ignoring the area commonly referred to as the G-spot. Many men have heard about it but are unsure what it actually means or where it is located. It is important to understand that the term describes an area of sensitivity rather than a guaranteed anatomical structure that produces the same response in every woman. For some women, stimulation of the front wall of the vagina can create pleasurable sensations, while others may feel little or no additional benefit from it. The area is generally described as being a few centimeters inside the vagina along the front wall, toward the abdomen. If a partner enjoys this type of stimulation, gentle pressure and a gradual curved movement may be more comfortable than rapid or forceful movements. Again, the response of the individual woman should determine what happens next. This is where many men make another mistake. They hear about a particular technique and assume they need to perform it exactly as described, regardless of their partner's reaction. That approach misses the entire point. If she enjoys a particular movement, you can continue or gradually adjust it. If her body language suggests discomfort, you should slow down or stop and communicate. Rapid, repetitive movement is not automatically more effective, and there is no need to treat intimacy like a mechanical task. One man in his 50s told me that he had avoided this type of stimulation because he did not understand it and was worried about doing something wrong. After learning that communication mattered more than perfection, he became more comfortable discussing preferences with his partner. She later told him that the biggest improvement was not simply the physical technique, it was the fact that he had become more attentive to her responses. The fifth mistake is failing to pay attention to feedback. This may be one of the most important principles in the entire discussion, because every woman responds differently. Some women prefer primarily external stimulation, while others may enjoy a combination of external and internal touch. Some prefer very light pressure, while others are comfortable with firmer contact. There is no universal formula. Verbal communication is one of the clearest ways to understand what your partner wants, but nonverbal signals can also provide useful information. Changes in breathing, movement, muscle tension, facial expressions, or pulling closer can all help you understand whether she is comfortable and enjoying the experience. At the same time, these signals should not replace communication. If you are uncertain, simply asking what feels good or whether she wants you to continue can prevent confusion and create a stronger sense of trust. One patient described how small adjustments made a surprisingly large difference in his relationship. He had assumed that he needed to make major changes, but his partner explained that simply changing the pace or angle slightly made the experience much more comfortable for her. That reinforced something I tell many of my patients. Intimacy is often improved through small, thoughtful adjustments rather than dramatic changes. The more willing you are to listen, observe, and adapt, the less you have to rely on guesswork. And once you understand that principle, you begin to see why intimacy after 50 does not have to become less fulfilling. In many cases, experience can actually become an advantage because you have more opportunity to understand your partner, communicate openly, and recognize that good intimacy is built through attention rather than speed. This brings us to another area that may sound basic, but is extremely important: hygiene. The sixth mistake is overlooking hygiene. This may sound like one of the simplest points in the entire conversation, but it is also one of the easiest things to get wrong. When intimate contact involves sensitive tissue, basic cleanliness matters. From a health perspective, dirt, bacteria, sharp nails, or small cuts around the fingers can contribute to irritation, discomfort, or infection. That does not mean intimacy needs to become complicated or clinical. It simply means that a few minutes of preparation can prevent an unnecessary problem. Wash your hands thoroughly before intimate contact. Keep your fingernails trimmed and smooth, and make sure there are no rough edges that could scratch delicate tissue. If you have a cut, skin irritation, or another issue affecting your hands, it is sensible to wait until it has healed before engaging in direct contact. These are simple precautions, but they demonstrate something important. Your partner's comfort and health should always be part of the experience. There is also an emotional reason hygiene matters. When you take the time to prepare properly, you communicate consideration. Your partner can recognize that you are thinking about her comfort rather than simply focusing on your own experience. I remember speaking with a man who had never realized that the rough edge of one of his fingernails was causing his partner discomfort. He had assumed that she simply was not responding well to the stimulation itself. Once he corrected the grooming issue and became more careful, her comfort improved significantly. It was a small change, but it demonstrated a larger principle that applies to intimacy at any age. Sometimes the solution is not a more complicated technique. Sometimes it is simply paying attention to the details you previously overlooked. The seventh mistake is ignoring emotional connection. This is something I want every man over 50 to understand, because physical technique, by itself, does not tell the whole story. A person can know exactly what movement to make and still fail to create a satisfying intimate experience if the emotional connection is missing. Feeling safe, respected, and emotionally connected can influence how relaxed and receptive a person feels. When someone is tense, distracted, worried, or uncomfortable, physical stimulation may not have the same effect. On the other hand, when partners feel close and secure with each other, it can become easier to relax, communicate, and enjoy physical intimacy. That is why emotional presence is not separate from physical pleasure. The two can work together. Practically, emotional connection can be expressed through simple things. Maintain eye contact when it feels natural. Speak gently. Reassure your partner. Pay attention to whether she seems comfortable, and do not make her feel pressured to respond in a particular way. Most importantly, be mentally present. If your attention is somewhere else, your partner will often notice. Intimacy requires more than physical proximity. It requires attention. One man told me that he had spent years focusing almost entirely on technique, believing that better technique would automatically produce better experiences. Eventually, he realized that when he became more emotionally attentive and stopped treating intimacy like a performance, his relationship changed. He and his partner felt more relaxed, more connected, and more satisfied. So, if you want to put everything we have discussed into a simple sequence, start with preparation. Make sure your hands are clean, your nails are trimmed and smooth, and you are approaching the situation with respect and patience. Then allow enough time for full-body affection and gradual foreplay. Do not treat this stage as something you need to rush through. Let anticipation develop naturally, and pay attention to how your partner responds. When you begin more direct stimulation, start gently rather than assuming that intensity is automatically desirable. If internal touch is something your partner wants, begin gradually and remain responsive to her comfort. The goal is not to follow a fixed script. The goal is to create an environment where both partners can communicate and adjust. As you continue, pay attention to feedback. Ask simple questions when necessary, and do not be afraid to make small changes in pressure, rhythm, or position based on what your partner tells you. If she enjoys a particular type of stimulation, you can continue or gradually build on it. If she seems uncomfortable, slow down or stop. There is nothing wrong with changing direction. In fact, being willing to adjust is one of the strongest signs of attentiveness. If she enjoys stimulation of the front vaginal wall, for example, gentle and gradual pressure may be more appropriate than rapid or forceful movement. But remember, not every woman experiences the same sensations, and there is no guarantee that a particular area will produce a specific response. Her individual experience is what matters. And throughout all of this, keep emotional connection at the center. Eye contact, affectionate words, reassurance, and patience can make physical intimacy feel more personal and meaningful. When you combine those elements with good hygiene and careful attention to your partner's feedback, you are no longer simply trying to perform a technique. You are creating an experience based on mutual comfort, trust, and communication. That distinction becomes especially important as we get older, because intimacy does not have to be about proving physical performance. It can be about understanding your partner more deeply and becoming more confident in responding to what she actually needs. Gentlemen, this is also why I want to challenge the idea that intimacy becomes less important or less enjoyable simply because you are over 50. Your body may change with age, and your partner's body may change as well, but that does not mean your capacity for closeness, affection, or pleasure disappears. In many cases, the experience you gain over the years can become one of your greatest strengths. You may understand patience better. You may be more comfortable communicating. You may have a deeper understanding of your partner's personality and preferences. Those qualities can be far more valuable than trying to imitate the habits of younger men. Intimacy is not a race, and it is not a competition. It is a shared experience. If there is one message I want you to remember from everything we have discussed so far, it is this: do not focus on doing everything perfectly. Focus on being attentive. Clean hands, smooth nails, gradual stimulation, patience, communication, and emotional presence are simple principles, but they can make a meaningful difference. When you stop guessing and start listening, intimacy can become much more comfortable and satisfying for both partners. And when you recognize that every woman is different, you stop looking for one universal technique and start paying attention to the person in front of you. That is where genuine connection begins, and that is also where many men discover that getting older does not have to mean becoming less confident or less capable in their intimate relationships. Now let's bring all of these principles together into a practical approach that you can remember without turning intimacy into a complicated checklist. The first step is preparation. Before any intimate contact, wash your hands carefully and make sure your fingernails are short, clean, and smooth. This is not about being overly cautious. It is simply about protecting sensitive tissue from unnecessary irritation or small scratches. Once you are prepared, focus on creating a comfortable environment. Give your partner time to relax, and do not immediately move toward direct genital stimulation. Begin with affection, kissing, gentle touching, and other forms of full-body contact that help create anticipation. Remember, the purpose of this stage is not simply to delay what comes next. It gives both of you time to become mentally and physically engaged. When you eventually move toward more direct stimulation, begin gently. If your partner is comfortable with external touch, start there and pay close attention to her reactions. There is no reason to rush. Small changes in pressure, rhythm, or location can make a significant difference, and her responses will help you understand what she prefers. If she communicates that she wants internal stimulation, approach it gradually and carefully. Begin with one finger rather than assuming that more intensity is necessary. Move slowly and allow her to guide the experience. If she wants something different, listen. If she asks you to stop, stop. If she asks for more pressure or a change in rhythm, adjust. These simple responses demonstrate respect and make communication a natural part of intimacy rather than something awkward that only happens when a problem occurs. If your partner enjoys stimulation of the front vaginal wall, you can explore that area gently and gradually. The commonly discussed G-spot is generally described as a sensitive region along the front wall of the vagina, but its location and sensitivity vary between women. Some women may find stimulation there pleasurable, while others may not experience anything particularly different. That is completely normal. Avoid assuming that every woman should respond the same way. Instead, use her feedback as your guide. A gentle, curved movement may be more comfortable for some women than rapid in-and-out motion. But again, there is no universal formula. What matters is whether your partner finds the sensation comfortable and enjoyable. This is where patience becomes especially important. Many men believe they need to constantly change movements to create stimulation, when in reality, once a partner finds something she enjoys, consistency can sometimes be more useful than endless experimentation. If she responds positively to a certain rhythm or pressure, you do not necessarily need to change it every few seconds. Give her body time to respond. Watch her breathing and movements, and listen to what she says. If she becomes more engaged, that may suggest the stimulation is working for her. If she pulls away, becomes tense, or tells you something does not feel right, take that seriously and adjust immediately. Being responsive is more important than being impressive. Another important point is that intimacy should never be reduced to orgasm alone. An orgasm can be pleasurable, but it is not the only measure of a successful intimate experience. A partner can feel deeply connected, relaxed, affectionate, and satisfied even when orgasm does not happen. When men become too focused on producing a specific outcome, they can unintentionally create pressure for themselves and their partners. That pressure can make it harder for both people to relax. Instead, focus on the quality of the experience. Are you both comfortable? Are you communicating? Is there affection and trust? Are you enjoying the moment rather than worrying about whether you are performing well enough? These questions are often much more useful than asking whether you achieved a particular result. This is especially relevant for men over 50 because many have spent decades associating masculinity with performance. They may feel that they need to maintain a certain level of physical ability or prove that they can satisfy their partner in a particular way. But healthy intimacy is broader than that. Your value as a partner is not determined by how quickly you can create an orgasm or how much physical intensity you can provide. Experience, patience, communication, and emotional maturity can be just as important, and sometimes even more important. As the years pass, your ability to slow down and pay attention can become an advantage rather than a limitation. There is also an important health consideration here. If either partner experiences persistent pain, bleeding, unusual irritation, or other symptoms during intimate contact, do not simply assume that discomfort is normal or something you should tolerate. Pain can have many causes, and persistent symptoms deserve appropriate medical attention. Good sexual health is not about pushing through discomfort. It is about understanding your body, respecting your partner's body, and knowing when something needs to be evaluated by a qualified healthcare professional. Open communication with a doctor can be particularly valuable when age-related changes, medications, hormonal changes, or other health factors begin affecting intimacy. So, when you approach intimacy tonight, or the next time you and your partner are together, remember the bigger picture. Prepare properly. Take your time. Start gently. Let arousal develop naturally. Pay attention to her verbal and nonverbal feedback. Adjust your pressure, speed, and technique according to what she communicates. Keep your hands clean and your nails smooth, and above all, remain emotionally present. These principles may sound simple, but simple does not mean unimportant. In fact, many of the most meaningful improvements in intimacy come from small changes in awareness rather than complicated techniques. And if you have been avoiding this subject because you feel embarrassed or because you think you should already know everything at your age, let me reassure you about something. There is no expiration date on learning. Bodies change, relationships change, preferences can change. What worked for you and your partner 10 or 20 years ago may not feel exactly the same today. That does not mean something is wrong. It simply means you need to keep communicating and remain curious about each other. The strongest relationships are not built by assuming you already know everything. They are built by continuing to listen. This is also why I encourage men to stop comparing themselves with what they see in movies, online content, or unrealistic portrayals of intimacy. Real relationships do not follow a script. Real partners have different preferences, different comfort levels, different bodies, and different emotional needs. What you see presented as universally effective may not be appropriate for your partner at all. Your goal should not be to copy someone else. Your goal should be to understand the person you are with. When you approach intimacy from that perspective, confidence becomes much more natural because you are no longer trying to guess what you are supposed to do. You are listening, observing, communicating, and responding. That is ultimately what mature intimacy is about. It is not speed, it is not performance, it is not proving that age has not changed you. It is connection, presence, patience, and mutual respect. And once you understand that, even small gestures can have a meaningful impact on a relationship. A gentle touch, a reassuring word, a moment of eye contact, or simply taking the time to notice how your partner is feeling can communicate more than a complicated technique ever could. As we move toward the final part, I want to leave you with a simple reminder that every man over 50 should carry into his intimate life. Getting older does not take away your ability to create closeness. In many ways, the experience you have gained can help you become a more attentive, patient, understanding partner than you were when you were younger. Gentlemen, as we come to the end of our discussion, I want you to remember that intimacy is not about speed, performance, or trying to prove something because you are getting older. It is about connection, awareness, patience, and being genuinely present with the person you love. The small things we have discussed today can make a meaningful difference. Taking your time, beginning gently, paying attention to your partner's reactions, communicating openly, and maintaining basic hygiene may sound simple, but these habits can completely change the quality of an intimate experience. When you stop treating intimacy like a task that needs to be completed and start seeing it as a shared experience, you create more room for comfort, trust, affection, and pleasure. Your partner's responses should always be your guide. Notice what she says, but also pay attention to the way she moves, breathes, relaxes, or responds to your touch. If something feels good to her, you can continue at a comfortable pace. If something feels uncomfortable, slow down, change your approach, or stop. There is no failure in making an adjustment. In fact, the ability to listen and respond is one of the most valuable skills you can bring into a relationship. Every woman is different, and preferences can change over time. Something that felt wonderful years ago may not feel the same today, and that is completely normal. The goal is not to memorize one perfect technique. The goal is to understand your partner as an individual. And please remember that emotional connection matters just as much as physical technique. A woman may feel more relaxed and comfortable when she knows that her partner is genuinely interested in her experience, rather than simply focused on his own satisfaction. Gentle communication, affection, eye contact, reassurance, and patience can help create that sense of safety. When both partners feel respected and understood, intimacy can become much more than a physical activity. It can become a way of strengthening the relationship itself. That is something many men discover only after they stop worrying so much about performance and begin focusing more on connection. If you are over 50 and you have been telling yourself that your most exciting or satisfying intimate years are behind you, I want you to reconsider that belief. Aging does bring changes, and those changes should be acknowledged rather than ignored. But growing older does not eliminate your ability to experience affection, desire, pleasure, or closeness. In many cases, maturity gives you qualities that can actually improve intimacy. You have more life experience. You may understand your partner better. You may have learned the value of patience, communication, and emotional stability. These are powerful advantages. You do not need to compete with younger men, and you certainly do not need to imitate unrealistic expectations created by movies or online content. Instead, use the experience you have gained to become more attentive. Ask questions when you are unsure. Listen when your partner tells you what she likes or dislikes. Be willing to slow down. Be willing to learn. And never assume that you are too old to improve your relationship. A healthy, intimate life is something that can continue to evolve throughout adulthood, as long as both partners feel comfortable, respected, and willing to communicate. If you or your partner experience persistent pain, irritation, bleeding, or another concerning symptom during intimacy, do not simply ignore it. Speak with an appropriate healthcare professional, because ongoing discomfort should not be considered a normal part of aging. So, if you take only a few ideas away from this video, remember these: prepare properly, keep your hands clean, and your nails trimmed and smooth. Give your partner enough time to become comfortable and aroused. Start gently, instead of assuming that stronger or faster is better. Pay attention to her feedback and adjust when necessary. Do not assume that one technique will work for every woman, and above all, maintain emotional connection throughout the experience. These principles are simple, but they are supported by one of the most important truths about intimacy. People respond best when they feel heard, respected, and understood. I also want you to understand that intimacy does not need to end with a particular outcome to be meaningful. Sometimes the most satisfying moments are simply the moments when two people feel close, relaxed, affectionate, and connected. Removing the pressure to perform can make it easier for both partners to enjoy the experience naturally. When you focus less on proving yourself and more on being present, you may find that confidence begins to return on its own. Confidence does not come from knowing every technique in the world. It comes from being comfortable enough to communicate, listen, adapt, and care about your partner's experience. So the next time you and your partner share an intimate moment, slow down and approach it differently. Do not rush toward the finish. Give attention to the beginning. Notice the small details. Ask what feels comfortable. Respond to her cues. Make room for affection and emotional connection. And remember that the goal is not to perform perfectly. The goal is to create an experience that both of you can enjoy and feel good about afterward. These are the habits that can help build stronger intimacy, greater trust, and a deeper sense of closeness over time. If this video gave you a new perspective, take a moment to like it and leave a comment telling me which of these points surprised you the most. Your experiences and questions may also help other men who are going through similar changes and may be too embarrassed to ask openly. And if you want more practical, evidence-informed guidance about men's health, relationships, confidence, and intimacy after 50, make sure you subscribe to the channel so you do not miss the next video. I'm Dr. Rose, and I want you to remember one final thing. Small, mindful changes today can create greater comfort, confidence, and connection tomorrow. Your age is not something you need to apologize for, and it does not automatically limit your ability to be a loving and attentive partner. In fact, the experience, patience, and understanding you have developed over the years can become some of your greatest strengths. Approach intimacy with respect, communicate openly, pay attention, and give yourself permission to keep learning. Because the strongest intimate relationships are not built on perfection. They are built on two people who are willing to understand each other, care for each other, and remain connected as they grow older together.